hi everybody and welcome. Thanks so much for tuning in today. I know it's a busy time of year for everyone right now, so we appreciate your time. So welcome to our third Thursday Lunch and Learn web series. It's organized by the Iowa Public Health Association's Education Committee. My name is Chelsea Keenan, and for those of you who have not joined before, I am a second-year Masters of Public Health student at the University of Iowa. So we basically dedicate this time every month to talk to different practitioners across the state, to talk to them a little bit about their successes and some of the things that they're working on, and maybe even some of the detours that happened along the way. The point is really just to connect and to learn and to strengthen the voice of public health across Iowa. So today we're going to be talking with Lori Hoch, who is over at the Myrture Medical Center. She's the director of public health there. And we're going to be talking a little bit about Shelby County's efforts to combat e-cigarette use in their community. So just some reminders, you all currently have your microphones on mute, but at the end of this, we definitely encourage questions. So I believe we'll let everyone take their microphones off mute if they have questions. So please, when that time comes, feel free to hop in and ask a question. So without further ado, I'm going to let Lori just give everybody a little introduction about herself and her path to public health. So Lori, why don't you take it away?
Well, yes, my name is Lori Hoch. I am the Director of Public Health here in Shelby County, and we are a hospital-based public health. So that gives us a different perspective, I think, sometimes than county-based, which is both good and not good. But for the most part, I think it's a good partner. I'm a nurse for 35 years. My path started in providing care in the hospital setting, and once we moved out to Western Iowa in '02, public health seemed to be the route for me, and I haven't looked back. Public health has been the place for me to grow my career. In fact, went back and got my bachelor's in 14 and graduated in 16. So it just broadened my perspective and horizon for doing that. So that's kind of a little bit about me as far as working here at Myrture's Department of Public Health. I have worked also in Crawford County's public health for many years. So got a little perspective because that was a county-based public health. So came to a hospital-based public health and have been here for the past 4 years and have enjoyed getting to know my Board of Health and looking and using our China hip and doing all of our programming. So it's been it's a steep learning curve. I'm not going to lie about that. This e-cigarette ordinance that we passed was my first experience with going through an ordinance process. So again, a learning curve, but I think it went fairly well. And that's a little bit about me.
Perfect. Well, thank you so much. Yeah, so she gave a great little hint there about what we're going to be talking about, and that is the e-cigarette ordinance that their community passed. They started working on it back in 2008. And so, Lori, why don't you just tell us a little bit about the background and why this was something your community was interested in doing and kind of the process there to work on that.
So this one, I wish I could say it was data driven. It really wasn't. I received the ordinance from Story County from our regional coordinator, Dawn Mao, and she just sent it out. And I said, I think I might take this to our Board of Health and see what they think about it. And so the next meeting, I had it on the agenda, and sure enough, we talked about it. And our Board of Health members were very interested in this. In fact, our chair is Dr. Phil Markham, and he is a dentist here in Harlan, and he had been seeing teens coming in that had been injured by e-cigarette batteries, for lack of a better word, blowing up and disfiguring their face and causing dental issues. So he was very much in favor of us trying to get out ahead of this problem. As he predicted and the Board of Health again agreed with, he thought it was going to continue to be a burgeoning issue and that we needed to take action. So the recommendation was to work with our county attorney on an ordinance. So that was in the fall of 2018. In March, we had the ordinance ready to go. We were on the Board of Supervisors agenda to talk about it. So you get in front of a camera, you talk about it, yeah, you garner their support, and going back to the Board of Health, they passed it unanimously to go ahead and do that. So that was an absolute yes, we need to do something. The Board of Supervisors were, once we explained it, talked it through it, they were an absolute yes. They, even though it really wasn't germane to vote at that time, they wanted to because they were so fired up about it. And so we had to wait another 30 days to get public comment. We put it out in the newspaper that this was an ordinance that was being voted on in May. And we did go to that May meeting. There was no pushback whatsoever from anybody, and it passed. So would you like to, I'm going to share a little bit about the ordinance.
Yeah, that would be great. Why don't you give us some details?
Okay, the ordinance kind of mirrors the Smoke-Free Act. So you cannot smoke in public places, but again, this is only for unincorporated areas of Shelby County. All of the cities get to make their own decisions if they want to support this. And they were asked to. At the time, Shelby County, in Shelby County, Harlan and Irwin both supported it. And we're going to take it up with their city councils. And so the ordinance that passed, again, no public places and all enclosed areas within places of employment were included. And also included were any outdoor seating areas where people congregated in public transit stations, school grounds, and the grounds of any public buildings owned by the county. So all of those were included, although very few of that population is in unincorporated Shelby County. So the penalty is $100 for your first offense and $200 for each subsequent offense, and including that second offense. So we liked it, but our goal was for it to be a stepping stone to kind of reach the incorporated areas, which are the cities. So that was our plan. We're still working on that. I think we may be getting some support from state legislators. They're looking to strengthen the Smoke-Free Air Act. So hopefully that will happen. Our Harlan, the city council did address it. They did bring it up, and I think that's what they're waiting for, that they would rather have it come from the state than their own city ordinance. So I think that's where it stands. Our Shelby County Wellness Alliance that Public Health is a strong partner in. They are also very supportive of this, of including e-cigarettes in that ordinance. They would like to have seen that happen. It did not. So there's still some things that we need to work through, but I think we're on the right track. I'm grateful for Story County and Don Mal for giving us the starting point, and then the strong support from the Board of Health and Board of Supervisors to make that ordinance happen.
Yeah, absolutely. So it sounds like we were kind of talking a little bit earlier that there are a few challenges just in the fact that you guys only have so much control, and it's essentially in the unincorporated areas. And so it really, you kind of have to rely on the cities to also kind of back this up. And sounds like they're waiting a little bit to see what the state's going to do. Mm-hmm. Yeah. So were there were there other challenges or anything when you guys were starting to try to get this pushed through? Or you said it sounded like, people, there wasn't a lot of pushback, but what were some other challenges in trying to get this going?
Well, just having no experience working with an ordinance before, really relying on the county attorney to help guide me on that. So that was like, okay, I'll write an ordinance. So yeah, that was interesting. But I'm glad I had the opportunity to work on it. Again, I couldn't ask for more support from the Board of Health and Board of Supervisors. So that's an opportunity to continue to push this issue. We also had a teen health fair right around the time of that ordinance, and vaping was one of those topics that was at our teen health fair, and probably one of the more popular ones for teens to ask more questions. They don't realize the impact of e-cigarettes on their lungs, and that it's coming to fruition more because we're learning more now that it's a reportable illness. It just is out in the news a lot that we are losing folks to this, to e-cigarettes and vaping, and young folk. So that's never a popular place to be. So our next step is, after the Teen Health Fair, we're trying to get a youth adult partnership group so that we can have content experts come to teens and talk about different wellness issues. And so vaping, of course, is going to be one of those. So that's kind of where we're at for next steps.
Yeah, definitely. And given that you didn't really have a lot of experience in policy work, what did you kind of learn about it in general, like the process? And what advice would you maybe give to others that might be a little nervous kind of stepping into that arena?
Don't be afraid to ask questions. You know, if you don't know, if you haven't been through it before, just own that. And it's okay to play the I'm new at this card. And they understand, because everybody has a starting point. Really lean on your county attorney, because that is that's what he does. So he was able to help guide me a little bit. I also just did Google searches on the internet, the World Wide Web. It knows everything. So, you know, and looked at different out-of-state areas too, what they were doing. And so that kind of helped a little bit as well.
Yeah, and so I would imagine there's quite a bit of education that kind of had to go on after this ordinance was passed. You talked a little bit about, you know, going to teen and youth fairs, but what are some other things that you guys kind of worked on to make sure people were aware of this?
So again, you posted in between our Board of Soups meetings. We posted it in the newspaper. We've done multiple press releases regarding it so that people are aware it is an ordinance. And we also did some partnering with the Jackson Recovery, which is now Rosecrans Jackson Recovery. They are doing education in the schools with the teens. We also working with law enforcement, so they understand what the ordinance is and how to enforce it and what the penalties are. So they're talking to teens, making sure that, because really in you know, all honesty, that we're really focusing on trying to reduce the number of children who are vaping in our communities. So because we just do more outreach and you continue to have collaborative conversations. I mentioned the Shelby County Wellness Alliance, talking to the folks in our alliance so that they're spreading this into their own agencies, and the schools, definitely the schools, because that's where the kids are that are our target for this initiative.
Yeah, absolutely. You know, you mentioned working with law enforcement to kind of educate them, but also they're a big player here because they have to enforce the ordinance. So what has that partnership kind of looked like?
Well, when you work in emergency preparedness, you have, and all public healths do that, you get to know your law enforcement folks a lot better, which is a good thing. And so you just reach out to them as partners. When you're partners at one table, it's easy to be partners at another table. And also our law enforcement is a piece of our Shelby County Prevent Child Abuse Council, very active partners. In fact, our chair is law enforcement, Harlan police officer, Derek Yamada. So that helps because you're talking to them on other avenues, and you know, then you have those other conversations that, okay, now you know this ordinance is passed. What can we do to work together to make sure that it is enforced? So we're very fortunate to have those relationships already established. So that kind of fueled that.
Yeah, absolutely. So what was the biggest lesson learned on your end?
How to write an ordinance.
That's a good lesson
Yeah,
to know.
yeah, because now they want to do a radon ordinance to do a point of sale radon ordinance. So now I have that experience. So yeah, and yeah, another lesson learned is when I brought that to the Board of Health, did I think it was important? Absolutely. But did I think that they would jump on it quite so quickly? No. But they were just so enthusiastic about it and so supportive of it that it just had to become a higher priority, and maybe some other things had to go back on that shelf for a little bit so that could go through. So yeah, lessons learned. You never know what really what topic they're going to be so passionate about, and that was it for them.
Yeah, and I mean, and it kind of came at a really great time because, as all of us know, that you know, e-cigarettes are more and more in the news for lots of reasons, and teen rates are going up, or teen use rates are going up. So it sounds like you guys were really kind of ahead of the curve on that a little bit.
Yeah, yeah, they had some foresight, and you know, in having the teen health fair conversations too, that was one of the things that the principal brought to my attention. You know, how can we help reduce vaping, because they're kind of powerless, and felt very much that this is a health issue that needs to be addressed. So I would agree with them. I would agree with them
Definitely.
that we're probably at about, even though our youth survey would say we're around 23% for the kids that say on the youth survey that they're actively vaping. I would say that's closer to 50% anecdotally by talking to school nurses and administration, and they're very concerned about this health issue.
Yeah, absolutely. Well, I want to open up the floor to you guys to ask your questions. We've got a little bit of a smaller group today, so don't be shy. If you've got any questions for Lori about the process, or the, you know, kind of the details of the ordinance or anything, please hop on and ask away.
Hi, Lori, can you hear me? This is
Hi.
Danielle Pettit-Majeski.
Hi, Danielle. I can hear you.
Hi, I'm good. How are you?
Good, good.
Good. Hey, thanks for talking about this. This is something that I have been trying to do in my own community. And, well, first of all, I would love if you'd send me a copy of your ordinance.
Okay.
I have just gotten my Board of Health to pass a paper, and I know that at the legislative forum a couple of weeks ago, we were talking about that making vaping included in the Smoke-Free Air Act is one of the priorities for IDPH this session, but I think it's really good for it to start in communities. And so I got some pushback when I approached this with my Board of Supervisors about a year and a half ago. And so I guess I would just like to hear more about how that conversation went, or if they are typically supportive, or how you were able to convince them. Because I know when I first started, it was before all of the lung injuries became prevalent.
Right. And was for me as well. So when I went to the Board of Soups meeting, again, one of our Board of Health members, Steve Kinkle, is a Board of Supervisor, is also on the Board of Supervisors. That's a requirement. So he was already in favor of it. So that helps. You already have a champion. And then one of the other Board of Supervisors had lost a spouse to lung cancer. So no, so that was just a very easy sell for my community, because between the two of them, it was just a no-brainer for them to try to prevent kids from getting addicted to nicotine and then maybe transitioning into smoking. So they were just, it was really easy for me. So that conversation was just pointing out the health hazards, or the unknown hazards, the developing brain, how it impacts that, and the crisis that the school was seeing it becoming. So that was, I guess those were the points that we used to help drive that home. And they were, again, they thought that this was a no-brainer at the local level.
great. I agree. Like, it should be a no-brainer. I had really struggled trying to get them, you know, because they're very much against, you know, the government telling you what to do.
Yeah, that's kind of what we faced with our. That's what we're facing with our Harlan City Council. They don't want to tell people what they can and cannot do. And my point is, we're the adults. This mostly impacts young adults and children. It's our role in society to try to guide them, and then when they are adults, they can make decisions within the law. So yeah.
Right.
So
I did have some success in my city to get e-cigarettes and vaping, basically in parks where children play, within a 30-foot perimeter of where children play.
Mm-hmm.
We couldn't make it enforceable beyond that 30-foot radius, but we thought we would start somewhere. Because my lieutenant on my police department, I looked at him, and because I sit on our city council, and I said, "Are you going to enforce this?" And he said, "No." So really, it's the 30-foot range, because we don't have capacity to enforce it beyond that. So I was just curious how that worked for you, but it sounds like you've had similar challenges.
Yeah, at the city level, at the, you know, as the Board of Soups, and what they can control, they were the ones. Again, it's called finding that champion who wants to go with you into this. And we had some champions that were willing to step up in the community. But again, yeah, in order for this to be really impactful, we need to get our cities on board.
Yeah, agreed. But that's a really great start. Props.
Thanks.
This is Lena, and Lori, this has just been such a fantastic conversation. Thank you for sharing all this, and Danielle, I know we've talked about the challenges that you have there too. Just a couple of things. One question, I'm wondering if Lori or Danielle or anybody else on the call has experienced anything that seems like it might be kind of an outside organized effort to keep down efforts to include vaping in the clean or indoor or outdoor air laws, like organized efforts from either other agents or associations, or like trade associations, or if you have vape shops in your community and seems like they're being supported by industry. So that's my question. And then also, to your point about sharing ordinances, IPHA is collecting sample ordinances on a variety of topics. I know, Danielle, you've already shared some. What we want to do is we're developing a kind of a sample local policy / ordinance database, and that will be hosted on our new website, and hopefully that will be ready in January. So just a little plug there. And so, Lori or Danielle, did either of you, or do you sense there'd be any kind of outside organized efforts against including vaping?
This is Lori.
So I think that there's people who are going to be against it. Honestly, I think the fact that we're seeing all of these lung injuries come up, I think that has changed a lot of the conversation, because once my Board of Supervisors kind of shot me down, I partnered with my county attorney, because he was seeing a lot of increased activity in youth regarding like danks. So those vape pods that were coming from Colorado that had high levels of THC, and we happened to just stumble upon it. And so he and I have spent quite a bit of time talking to different civics organizations about the uptick, especially after all of the lung injuries started happening. And so we've really started to raise awareness. And so we haven't seen people that I've noticed who are advocating against any of these ordinances. I think most people are nervous, and they're realizing that this is dangerous. That's just been my perception.
And for me, this is Lori again. No organized efforts to try to defeat Smoke-Free Air Act, and including vaping, none. But then, you know, we are Western Iowa, small communities, and no one has voiced that.
Great. Just thinking back to my days in the 90s working on the original series of local ordinances, this is during my time in Minnesota at least, you know, having that groundswell of community support, local ordinances, and building up to the state level is such a powerful thing. So I think, as you know, the more work we can do at the local level gives the cover, I guess, to the state to act at a state level, and, you know, kind of working grassroots, grass tops, and as much as we can do before the, you know, industry model ordinances and things like that come in, because I have a feeling that they're using a similar playbook to we saw, you know, 20, 30 years ago.
Mm-hmm.
Are there any other questions for Lori? All right, well, thank you guys so much for sharing your time with us today. And thank you, Lori, for sharing your experiences. It's been really insightful and really interesting. The IPHA Education Committee we're still planning, I was gonna say the rest of the year, but this year is almost over, so we're still planning our webinars for 2020. So they welcome your ideas for future lunch and learns and encourage anyone with interest to join the committee. Oh, wait, got a question that just popped in. Does Shelby County have a drug-free communities grant holder? Sorry, this is coming from someone whose audio isn't working.
Okay. No, not to my knowledge, no. And I think I would know, so no.
Okay. Great. But all of these recordings are going to be, or all of these webinars are recorded, and they are going to be archived and available on the Iowa Public Health Association's YouTube channel. So, you know, if there's anything that you missed or you want to go back and re-listen to something, they're definitely there for you. You guys all have just a really happy holiday, and we will see you all next month. In January, we're going to be having Kelly Gerds and John Peterson come and join us to talk to us a little bit. So thank you guys so much for your time. We really appreciate it. Oh, and sorry, I'm getting all sorts of messages popping up. I just want to make sure I don't miss anything important. So Kelly Gerds and John Peterson are from Iowa APA, and they're going to be talking about the intersection of planning and public health. And yeah, so thank you guys so much for your time.